So hello friends, so today I am going to make a video on the revision of anemia. So now in this video I have considered that some points that you have understood or you know. So first of all, there are definition of anemia, that a decrease in the hemoglobin level or RBC level according to age and sex. So this is called anemia. So in writing this definition I have considered that all of you must know the normal hemoglobin range in males, females and in newborns, and also similarly a normal RBC range in both males and females. And also that, and on the basis of hemoglobin level also you can see here that on the basis of hemoglobin levels also so friends also, and on the basis of hemoglobin level also, so here basically so patient can be classified into mild, moderate and severe anemia. So friends, so now I'm going to explain about the aplastic anemia. But so here, so this is a abnormal thing. So the a normal thing that you must know or that should be in your mind is about the formation of, about this concept that you must know, that is how from red bone marrow. So here basically that is from plurihematopoietic stem cells RBC produced. So therefore that is, as I discussed in aplastic anemia, that is, so here basically chemicals and autoantibodies, so here due to autoimmune disorders, so here basically attack this red bone marrow. As a result, that is no stem cells or no plurihematopoietic stem cells produced, so therefore no colony forming unit erythrocyte, so therefore no RBC or less RBC, so therefore aplastic anemia. So therefore basically anemia occurring due to dysfunction of bone marrow. So this is aplastic anemia. So now I am going to discuss you about the megaloblastic anemia. So before discussing the megaloblastic anemia, the normal thing that you must know, that is before understanding this megaloblastic anemia, that is the normal, that is biochemical reaction that you must know is about the reaction related to vitamin B12 and here folic acid, and how that is through this vitamin B12 and folic acid DNA maturation occurs, first thing. And also that you should know that how is erythropoiesis done, or how is erythrocyte formed from this colony forming unit erythrocyte. That is proerythroblast, basophil erythroblast, polychromatophil erythroblast, orthochromatic erythroblast, reticulocyte, and then so here it enters into blood capillaries and RBC. And here basically, and all these points also that you should know, that is on moving from, that is proerythroblast to RBC stage, cell size goes on increasing, so therefore that is the size of this, so here blast, that is proerythroblast, basophil erythroblast is greater than that of normal RBC. That is this concept that you must know. So therefore so I have written that vitamin B12 and folic acid essential for DNA maturation. So therefore then this DNA maturation causes the formation of erythropoiesis from proerythroblast. So therefore that is, you see that if no vitamin B12 or no folic acid, then no DNA maturation, then no blast cells, like so you have proerythroblast like this, so you have proerythroblast, basophil erythroblast or polychromatophil erythroblast. So therefore that is megaloblastic anemia, because that, as I have already discussed, that this, so here if no RBC, if this RBC does not form, so then automatically that is basophil erythroblast, polychromatophil erythroblast, orthochromatic erythroblast, that is all these blast cells will appear in the, that is in the blood capillaries, and in serum examination, that is you will find that is large size RBCs are present, and all these things you will do in the hematology practical also. So therefore I written that the anemia occurring due to deficiency of vitamin B12 or folic acid, where large immature RBCs present in the blood, called megaloblastic anemia. So now I am going to discuss you about the iron deficiency. So now friends, but before discussing this iron deficiency anemia, that normal thing that you must know is that, so here basically how is hemoglobin chain from heme and globin, and what is the role of, so here iron in the formation of hemoglobin. So therefore that is all these things that you should know. So therefore that is I've written that, so therefore no iron, so that means iron deficiency anemia, that means no iron, no proper hemoglobin synthesis, so therefore RBC is small in size, so here microcytic and has less hemoglobin content, so therefore iron deficiency, so therefore iron deficiency anemia, that means IDA occurs, because you know that, so therefore that is if no hemoglobin is present, then this hemoglobin also contributes to the size of RBC. And also that you should know that as I discussed that in the last, so here also that I said, because of the hemoglobin also, that is the size of RBC increases, so therefore if no hemoglobin then size decreases. And here basically that as I discussed why fatigue occurs, and also why spoon shaped nails occurs, so here founding IDA and pallor found, and also and I also, so here explaining that, so here in iron deficiency anemia, basically how that is iron deficiency anemia leads to, so here basically improper, so here basically T3 and T4, so here thyroid hormone synthesis, and this improper, so here basically T3 and T4 synthesis leads to, so here poor performance and here impaired growth. So therefore that is I have written that spoon shaped nails, so here developing ID iron deficiency anemia, and impaired growth also develops in so here IDA, so here iron deficiency anemia due to iron deficiency, because it is for T3 iron required. So now the last thing that I am going to discuss here about a hemolytic anemia. So therefore that as I have already discussed that, so here it occurs due to abnormality in the shape of RBC. So therefore that is you must know what is a normal shape of RBC. So know that the normal shape of RBC is biconcave disc where hemoglobin is present at the center, and here, and since it has, and due to this biconcave disc, so therefore that is it can, so here basically resist, so here compression, so therefore compression can be resist, so therefore compression can be resist, but this, so here that is a small spherical shaped RBC can't reduce, so here such compression, so therefore that due to such compression, so therefore that is when this small and spherical shaped RBC, so here basically pass through spleen, then they get easily ruptured. So now I'm going to discuss about a sickle cell anemia. So here that is, so before discussing the sickle cell anemia, that is I considered that you should know basically that is which hemoglobin synthesis, which chain of hemoglobin, that is which chain of hemoglobin that is affected in sickle cell anemia. So basically it is the, so here beta hemoglobin chain of, so here beta globin chain of hemoglobin affected, and here normally, so here at the 6th position glutamate present, but in sickle cell anemia that this is replaced by valine, so therefore this leads to hemoglobin S, and when this hemoglobin S exposed to low hemoglobin or exposed to hemoglobin concentration low, so therefore that is it becomes sickle cell RBC, and the sickle cell RBC can't easily accommodate, so you can't easily accommodate hemoglobin, so therefore basically anemia develops. So now this is about the erythroblastosis fetalis, and here that is, and you should know that so here it develops, that is when the fetus is Rh positive and the mother is Rh negative, that this antibodies formed by the mother's body, so here attacks the, so here basically RBC of Rh fetus, and as a result also excessive, so here hemorrhage of the fetus develops with hemolytic anemia. So now I am going to explain you about this morphological classification of anemia given in your book. So friends, as I have that is told you the importance of vitamin B12, and here basically tetrahydrofolic acid, folate, or the folic acid in the erythropoiesis, that you know that they do the DNA maturation. And this DNA maturation is important for the formation of, so here that is proper RBC from the proerythroblast. So here that is, if proper RBC is not formed, that is immature, that is blastic cells like early erythroblast or intermediate erythroblast or late normoblast, that is all this. So here basically all these blastic cells, immature blastic cells which have larger size than RBC will appear in the blood. So therefore that is in blood, that is RBCs will have, that is larger size than normal. So therefore that is, you can see here basically that is macrocytic, that means larger size. So therefore in macrocytic, that is vitamin B12 deficiency, so see, so megaloblastic, so therefore and folate deficiency come under this macrocytic. MCV, that means, so here's simple meaning, that is where the size of RBC is larger. So friends, now in hemolytic jaundice, that is I have mentioned you that, so first of all that you know that is hemolytic jaundice also occurs due to excessive destruction of RBC. So here that you can see here that here also that in normal situation, that is the normal amount of hemoglobin is formed, and also that is rupturing of hemoglobin is in a balanced manner. But in case of like that hemolytic jaundice or hemolytic anemia, though the normal amount of RBC is formed, but this rupturing of hemoglobin or RBC is not balanced. So therefore that is, you have seen that that in case of hemolytic jaundice or hemolytic anemia, that is the size of RBC is normal, and here also that is normocytic, that means the size of RBC normal. So therefore, so due to post-hemorrhagic, that means due to excessive destruction of RBC, that is anemia occurs. So therefore post-hemorrhagic. And also that is, as I have already explained you, that is in iron deficiency anemia, that you can see that is that this hemoglobin is essential, hemoglobin chain is essential, and when this hemoglobin also that is present in the RBC, then only that is also its size increases. But if no hemoglobin, then its size is reduced. So therefore this iron deficiency anemia comes under microcytic, that means where the size of RBC is smaller than the normal. And thalassemia, that is, it is also a condition where that is either that is in thalassemia, you can see here that is either, so here alpha or beta chain of hemoglobin affected. So if hemoglobin affected, then automatically the size of RBC goes on reduction. And here hemoglobinopathy is like sickle cell anemia or chronic disease, where also hemoglobin chain is affected. So therefore that is, so this is a morphological classification of anemias. So thank you.